Real talk, mama. The tiny baby symptoms we brush off? Some are the exact ones pediatricians sprint for. But here's the flip. What looks small can be the biggest red flag. Today, I'll show you 6 nothing signs that doctors treat like emergencies. So your reality completely beats expectations. I'm a mom, sharing what I've learned from pediatricians and trusted sources like the AAP, CDC, NHS, and WHO. Ready? Let's make I'm not sure turn into I know what to do. Number 1. Sudden drop in feeding interest. We all know babies have sleepy days, but here's the truth. Newborns rarely skip multiple feeds unless something's wrong. If your baby suddenly refuses more than one feed, drinks much less, or sucks weekly, that's a red flag. Doctors see it as the body's first warning of infection or dehydration. A healthy baby should have 6 to 8 wet diapers every 24 hours after the first week. If you count fewer than 6, or there's no urine for 6 to 8 hours, call your pediatrician right away. Dehydration in newborns can worsen within hours, not days. Don't wait. Check the mouth for dryness and the soft spot for sinking. If feeding stays poor or your baby is unusually sleepy, get help the same day. Because when babies stop eating, it's never just a phase. It's their way of whispering for help. Number 2. Grunting or rapid breathing while feeding. Newborns make funny snorts and squeaks, but grunting, chest pulling, or fast breathing while feeding is a cry for help. Here's the line doctors use. More than 60 breaths per minute, skin tugging under the ribs, or nostrils flaring equals respiratory distress. Pause the feed and watch the chest. If it stays fast or noisy for more than a minute, don't search online. Call your pediatrician or head to urgent care. Mayo Clinic and AAP guides confirm these are emergency signs that oxygen flow is low. Remember, a baby struggling to breathe can't feed well. You might notice sweating, bluish lips, or pauses between sucks. Those are your go-now clues. One quick call can make the difference between a scary night and a safe recovery. Number 3. Gray or mottled skin tone. Sometimes a baby looks pale or blotchy when the room's cold. That's fine if color returns fast. But skin that stays gray, pale, or patchy even after warming up can mean poor circulation or low oxygen. Doctors recognize this instantly. It's how the body shows the heart or lungs are struggling. Try warming the baby or adding a blanket. If the color doesn't return within a few minutes, or the lips and fingertips look bluish, go to the ER immediately. ER pediatricians list this among top emergency signs because when oxygen drops, every tiny organ begins to fight for air. So, if you're ever unsure whether it's lighting or something deeper, check twice and trust your gut. Babies shouldn't look gray. Number 4. Suddenly weak or high-pitched cry. You know your babies cry better than anyone. That's why a change, thin, shrill, or unusually weak, should stop you in your tracks. Moms often think, maybe he's tired or teething, but pediatricians think pain or pressure inside the brain, sometimes from infection or dehydration. The CDC and Children's Hospital of Philadelphia note that a high-pitched, piercing cry can be an early sign of meningitis or swelling. If your baby's cry suddenly sounds off and doesn't return to normal after comfort or feeding, call your doctor right away. Combine that with fever, poor feeding, or stiffness, and it's an emergency. Never ignore your intuition. A mother's ear often catches what machines miss. Number 5. Unusual diaper color or smell. Babies' diapers come in every shade of mustard, but 3 colors mean call now: white, black, or red. White or gray stool, called a colic, can mean a bile duct blockage that harms the liver. Black, tar-like stool, after the first few days of life, can signal old blood in the digestive tract. Bright red streaks could mean fresh bleeding or irritation. Even a strong metallic or foul smell deserves a quick check. Johns Hopkins pediatricians call early color changes one of the easiest life-saving clues. Before panicking, take a clear photo and note the time. It helps your doctor decide whether it's urgent or safe to monitor. But don't delay the call. When it comes to diapers, color really can save lives.